Hey there, Megan Jansen with Employee Wellness Solutions Network. I'm still on a mission. I'm talking to several professionals in the industry of employee and corporate wellness as we continue to elevate the conversation and profile around healthy people at work. Today, I have the privilege of stealing a few minutes from Anne-Marie Kirby. Anne-Marie is the co-founder and CEO of Core Health Technologies. She's in Kelowna. Thank you so much for taking a few minutes today, Anne-Marie, and talking to me about what we both love.
You're welcome, Megan. My pleasure.
Let's get talking into this. You've been in the preventative health and wellness space for a while. You started, interestingly, in the hospital world. So share with me how you got into this whole preventative health and wellness angle of health.
Well, it's a little bit of a funny story. I am trained as a software engineer, so I was a programmer. My first co-op term was with a company that did hospital information systems, and as a co-op student often does, gets kind of pigeonholed into an industry. So I worked with a number of different hospital information system vendors. And truthfully, I was never a big fan of healthcare, blood, anything related to unwellness. That being a computer programmer is the opposite end of being a people healthcare provider. But so I was never really in a happy place there, but I did a lot of good work in hospital information systems. And so when I saw prevention start to come into the realm of our reality, I thought, now that is a great idea. That is something I can really get behind. As opposed to, I've always wondered why when people get sicker and sicker, we just build more hospitals rather than looking at the root cause. So I've always kept an eye on prevention. And then when we saw the active communities start to take charge, we switched into this and started up Core Health.
Awesome. So with workplace wellness specifically, and we're talking about employees and optimizing their health and wellness so they can be not only productive at work, happy at work, but also enjoy their families as well. We talk now a lot more about health promotion, prevention versus reaction. And so in your world of the technology space, have you found there to be any trends pertaining to employee health really being something that can be considered prevention based?
It is funny, when I started this company and I tell people what we were doing, they'd say, what is employee wellness? What is a health risk assessment? Nobody had any idea. I almost didn't say anything because I'd have to explain the whole industry to them.
Yeah.
But now it's become accepted. Almost every company has some form of employee health. And it's just constantly on everyone's mind, especially now. I think, according to a fairly recent Gallup research report, productivity is just not in good shape with people. And so much of that relies on a person's health. If you're unhealthy, you cannot be productive or engaged. So we're seeing it become part of business strategy as opposed to kind of a tag on, oh, it's just an HR benefit. It's now becoming more of a strategy, I think, in workplaces.
And to take it even a step further, in various presentations and different conferences and different things that we're part of, we're actually getting away from talking about wellness as a wellness program. We're really switching gears and saying, it's not a program. It's a strategic approach to health. That's what it is. It goes far beyond a program anymore.
Yeah, absolutely. I think it's starting to follow the same path as safety. If you look back 50 or 60 years ago, there weren't that many safety programs within organizations, but it became law. And if you look now, I compare it to safety because in both cases, they're hard to measure. You can't measure what didn't happen. So if you have a really good safety program, you technically have nothing to measure. because you don't know how many accidents there were going to be, so you don't know how many you prevented. Same with wellness. You can't really count how many people you saved or you made better. So it's just a challenge through and through, I think, along the same lines. But we've seen safety change from, instead of measuring what doesn't happen, to measuring the actions you took to make a good program. And I think wellness could move there. It's starting to move there. I'm a big proponent of measuring how many executives you have in your wellness program, how many touches did you have, like how many meetings mentioned wellness, how many managers talked about it, or well-being, which is probably the more common term now. But we need to treat it the same as we did safety and have it go down that same path, I think, to get really big results.
Excellent. That's a really great way of thinking about it, actually. Really insightful. In terms of, also another key word we're hearing in this industry is culture. And, you know, organizations that have a culture that is more accepting of health and wellness within their four walls, we do find those organizations to be even that much more successful when it comes to engagement and the leadership support and those touch points that are really designed to engage as many people as we can. What are your thoughts on that?
It's interesting. My company was nominated by CMHA last year, I guess it was, for...
Congratulations.
Thanks. And we were the second runner-up for the small business category for mental health. And it's funny, the organization that won had a very specific program that was very prescriptive. They had plans, they implemented certain things for mental health. And we went into it and we were judged. And we didn't have a specific program, which I thought was so interesting because it's all about our culture. It's a culture of caring about every single person and trying to make sure every single person is addressed as an individual. So I found that being the difference. They had a specific program. We just had a culture around mental health. I'm not sure what I'm telling you here, Megan, but
no, I like that.
I found it a very interesting parallel. When we didn't win, I can see clearly why we didn't. We had all these things we were doing
that you were doing anyway. It's almost like ingrained. Yeah, it's almost like ingrained in your culture. So
yeah, it is.
That's wonderful.
Totally. So yeah, so I think culture of kindness is really what it stems from.
Love it.
And caring about people.
And brings me into another thought. In doing, you know, some of the international work and different, you know, professionals I'm speaking with, the tagline value on investment and value on caring are becoming more mainstream in this industry versus just return on investment. Like we're finding that this industry is shifting a little bit more toward the caring, the kindness, the value on healthy people.
That's interesting. I have not heard value on caring. That is interesting.
Yeah, it's definitely something I feel like the industry has shifted. Even the last 15 years doing this, it started out as very different than it is today. And you know, it is an exciting time. You've been in this world for a long time as well. So I think you probably can appreciate these trends we're seeing in shifting that conversation.
Yeah, exactly.
Anne-Marie, as we tie up our discussion today, can you share any last minute thoughts on where the industry is going, maybe some of the different things you're seeing in the industry, and any final thoughts you'd like to share?
I guess I wish we could call it value on caring and that we could justify having well-being programs based on that. But ultimately, we're dealing with businesses that have expenses and have to have profit and have to have shareholders. Something that Core Health is doing is looking more at productivity and more closely linking into programs for like absence, leave, disability, and just becoming part of the mainstream of HR solutions. So engagement is huge. And I think the term gets misused a little bit. Like there's engagement as in I'm actually in the program and doing something, as opposed to discretionary effort and where an employee is going to really focus and put their time and energy. So Core Health personally is looking on expanding away from just well-being, where it is hard. It is really hard to prove that there is value in it, to more health, productivity, and discretionary effort. So it's because someone has to say, yeah, we want to spend that money and it will come back to us. So productivity is a place that we can hang our hat and actually get evidence that it's working.
Love that. That's very interesting. Tracking those metrics are critical. And if the more I think organizations like yourselves can provide some solutions in that, it can show those changes and those advances within this industry. You know, we just need more and more support. And if leaders can see some concrete changes, then it's definitely it's a great place to be.
It feeds into it. And even with my own company, we have 30 people in the company, and I can see, going back to, we have a caring culture, but I can also see that we have highly productive people that will do what it takes to make our customers happy. So it all works, but what's the number you can put on that? That's what we're working towards.
Awesome. Well, good luck with that, and I look forward to tracking and learning more as you continue to really work in this space, and I think pioneer some of this data that you're wanting. So congratulations.
Thanks, Megan.
Yeah,
good luck to you as well.
Thank you very much. It's been a pleasure, and thanks so much for your time this morning.
You're welcome.